With my experience, I would say most of the cases do finish within a time frame of 2 years. Namaste friends. Today we will be discussing about how long does the braces treatment last. So the average time for braces treatment is 1 to 3 years depending upon the type of severity of the malocclusion. It also depends upon a variety of factors which may contribute to the existing malocclusion. The first factor which determines the length of the treatment is the type of brackets used for treating the malocclusion. The most common brackets used for treating malocclusion is the metal brackets. Also, depending upon whether cavities are present, gum recession is present or enamel erosion is present, the severity may also add up to the length of the treatment. The other brackets which are used are ceramic brackets. Though the treatment almost results in the similar outcome, but it may also add up to a little bit of extra time for treating the same malocclusion because of the friction involved. The other variety of bracket is the lingual brackets, which are totally aesthetic bracket. However, they may take a little bit extra time and it may add up to a little bit of discomfort to the patient because they are placed on the inside surface of the teeth rather than the outside surface of the teeth. However, the most significant brackets which reduce the treatment time as claimed by the makers are the self-ligating brackets, which significantly reduce the treatment time because they do not have any friction involved. And the last category involves aligners, which are plastic like trays which are worn by the patients, and they result in the correction of the malocclusion. So depending upon the severity of malocclusion, the type of brackets will also decide how much treatment time is taken. The second factor which decides the treatment time is whether the treatment is done as an extraction case or a non-extraction case. Sometimes the position of the teeth is so much crooked that the teeth may have to be removed so as to create space and treat the malocclusion. So in treating such cases, it may require more amount of time as compared to the normal alignment cases. The third factor which determines the length of the treatment is the kind of the bite present. Sometimes patients may have a deep bite or an open bite or a cross bite. So if treatment of bite is also associated, then it may take a longer treatment time as compared to only cases in which alignment of teeth is needed. The next factor which determines the length of treatment is whether it is done in a single phase or it is done as a two-phase treatment. Single phase treatment is the one in which the patients are at the correct age. They do not require any correction of their jaw position. However, sometimes patients who have smaller jaw, they require two-phase treatment in which an appliance has to be given at an initial date, and then after the correction of the malocclusion, the braces have to be placed to correct the alignment of the teeth. So this results in a greater duration of treatment up to 3 years as compared to a single year of treatment only required for alignment of teeth. Next factor which influences the length of the treatment is the age of the patient. The patients who start their treatment at an early age have greater bone turnover, and therefore their treatment time is faster as compared to patients who seek treatment at an older age, and since the bone density changes, the treatment time may also vary. The last important factor is whether the patients have significant jaw deformity which may require braces along with surgery. So patients who undergo surgical orthodontics may require greater length of the treatment as compared to patients who only require alignment of teeth. So to conclude, the treatment time needed for braces treatment may vary from 1 to 3 years depending upon the severity of the malocclusion. With my experience, I would say most of the cases do finish within a time frame of 2 years.